This is our technique for an arthroscopic interpositional tuberosity graft. This is a patient who was not felt to have a repairable tear and was not a good candidate for a reverse shoulder, and we chose this technique over something such as a superior capsular reconstruction. So we'll begin by decorticating the greater tuberosity. We will also go further medial compared to a standard rotator cuff repair. This is placing the medial row anchor. And as you can see, we're going to place our anchors just off the articular cartilage. The anchors we've chosen for this case actually have a knotless mechanism within the anchor itself. And we're going to utilize the knotless mechanism and repair sutures to help reduce the graft to the medial footprint. We're going to utilize a commercially available measuring device so that we can measure between the medial row anchors. So here we are measuring between the medial anchor and the posterior anchor. And then once we do that, we'll actually get an estimation in terms of how far lateral we want the graft to go. Once we make our measurements, we'll go back to the back table so that we can prepare the graft. And then certainly the key to procedures such as this is suture management. So we'll utilize the working portals so that we can avoid entanglement. The other thing that's very valuable through the lateral cannula is this commercially available dividing device, which will basically create segments or quadrants of the cannula to avoid entanglement of these knotless sutures. So here we are outside the shoulder. We have the knotless sutures into one of the 4 quadrants, so they're separated. We're going to use a free needle to pass the repair suture from the anterior medial anchor into the anterior and medial aspect of the graft. And then we pass the knotless mechanism through the anchor. So we're going to go from anterior to posterior. So here we are passing the suture through the medial aspect of the graft. And then we're going to complete passing the sutures through the medial aspect of the graft on the posterior side. So here we are passing the knotless suture through the posterior anchor. And so once that's performed, then we're going to remove the segmental divider so that we can actually pass the graft through the cannula. And that's a combination of tensioning the medial knotless sutures while also pushing the graft through the cannula with any number of devices. So by tensioning the medial knotless anchors, we'll reduce the graft medial, and then these lateral sided sutures that we've passed can be very valuable in terms of reducing the graft laterally while we take the medial sided tapes and perform a transosseous equivalent type of repair laterally. We're just going to use a little wire here to pass these lateral tensioning sutures so that we can place the graft on tension. It's just helpful in terms of reducing the graft while we grab the medial-sided suture tapes. So now we're grabbing the medial-sided sutures from the posterior anchor, the medial anchor, and the anterior anchor. And then we're going to bring it lateral, and then we're also going to incorporate that posterolateral stitch as well. So this is placing our lateral row anchors, the first, and then here's the second anterior anchor. And then the last thing we'll do is we'll actually repair the rotator cuff to the graft, both posterior as well as anterior, as long as there's adequate tissue. So you can see the graft goes right up to the articular surface, further medial than typical for a rotator cuff repair. And you can see that it acts like an interpositional graft or biologic interpositional graft under the acromion on top of the greater tuberosity. Thank you very much.